Hi, everybody. Welcome to today's Student-Led Journal Club. My name is Anne-Marie Parker. I'm a research associate on the Joplin campus of KCU. And today I will be introducing student Dr. Jennifer Perrault. Student Dr. Perrault is a first-year medical student at the University of Pikeville, Kentucky, College of Osteopathic Medicine. She earned her bachelor's degree in biology from the University of Wisconsin Oshkosh and worked as a lab technician after graduating. She's interested in neurosurgery and aerospace medicine. And she is a nerve presenter, so she's with the Neuroscience Educational Interest Research Group. If you want to find out more about that, you can email me or go to the MKRC Canvas page, and then there's a nerve section under the Student-Led Journal Club section. So if neuro is something that really excites you and you want to get involved with it, feel free to check that out, and there's more information there. So student Dr. Perrault, the floor is yours for your presentation.
Thank you. So my name is Jennifer Perrault. I'll be presenting non-invasive evaluation of intracranial pressure in patients with traumatic brain injury by transcranial Doppler ultrasound. It's quite the mouthful. So first I'd like to start off with some objectives. If I can get this, there we go. So first, why do we need non-invasive methods of measuring intracranial pressure? What is the relationship between pulsatility index, optic nerve sheath diameter, and intracranial pressure? And then what is transcranial Doppler ultrasound and how does it relate to intracranial pressure? So first we're going to start off with measuring intracranial pressure. And currently the gold standard of measuring intracranial pressure, also called ICP, are invasive methods. And there are a couple problems with that. It can cause bleeding, iatrogenic infection, and it requires a bacteria-free surgical environment. So we want to look at more non-invasive methods for measuring ICP, especially in patients with traumatic brain injury. And so one of those methods is transcranial Doppler ultrasonography, or TCD. So TCD measures the cerebral blood flow of the middle cerebral artery, and it's used to calculate pulsatility index, which is PI. And PI evaluates the compliance and elasticity of arterial resistance. Pulsatility index is calculated by subtracting the peak systolic velocity and the end diastolic velocity and dividing by the mean flow velocity. Currently, there are differing conclusions about the relationship between PI and how it relates to invasive measurements of ICP. So this study kind of looks at how reliable that is. So the purpose of this study was to examine the relationship between optic nerve sheath diameter, also called ONSD, or PI, and the relationship to ICP. So ONSD and PI were measured at different intervals after surgery, and then they were compared to invasive measurements in patients with a traumatic brain injury. So in those patients, parenchymal probes were surgically placed, and then they continuously monitored ICP for 7 days after the surgery. Included in the study, there were 68 patients with TBI that were chosen based on specific inclusion and exclusion criteria. And of those 68 patients, 46 were males. TCD and ONSD data were recorded 135 times. Of the TCD data, there was 115 points that were included, and of the ONSD data, 86 points were included. So TCD was used to monitor the middle cerebral artery bilaterally, and the peak systolic velocity, end diastolic velocity, mean flow velocity, and PI were all recorded at the same time, and that was all done once a day. ONSD was measured once a day with an ultrasound probe, and each eye was measured twice, and the average was used for the data analysis. So the results, ONSD and ICP 1 week after surgery, overall ONSD was strongly correlated with ICP, and that had a p-value of less than 0.001. There was a strong correlation when ICP was 20 milligrams mercury, and a weaker correlation when ICP was less than that. When ONSD was stratified, there was a strong correlation when it was greater than 5 millimeters, but not when it was less than 5 millimeters. Then looking at PI, there was a strong correlation with an ICP of 15 to 20 and also when it was above 20. So overall, it was moderately correlated with ICP, but when ICP was stratified, there was no correlation between the two. When looking at how the correlation changed after surgery, there was no correlation that was found 1 to 2 days after. There's a moderate correlation 3 to 5 days after, and there was a strong correlation 6 to 7 days after. So going further, this study used something called Youdin's index, which shows the performance of a dichotomous diagnostic test, and it estimates the probability of an informed decision. So when the Youdin's index is equal to 1, there are no false positives and no false negatives for the test. So it's a pretty reliable test. If it's a 0 value, then the test gives the same proportion of positive results and negative results with or without the disease. So that means the test is kind of useless and not really accurate. So in this case, when PI was greater than or equal to 1.2, the Youdin index is 0.343. So that was kind of low. The area under the curve tells us how good the model is, in this case PI, at predicting intracranial hypertension, which is when ICP is greater than or equal to 20. So here the area under the curve is 0.729, which is pretty close to 1. So that's a pretty good indicator that PI can predict intracranial hypertension. However, when you look at optic nerve sheath diameter and how accurate it is at predicting hypertension, that has an area under the curve of 0.9. So it's even more accurate at predicting intracranial hypertension than PI is. And then when you use both PI and ONSD together to predict hypertension, the area under the curve is 0.943, which is even higher. However, the researchers saw that this wasn't a statistically significant difference, so compared to ONSN or ONSD alone. So that was a lot of numbers and graphs. So what does it all mean? When ICP decreases, ONSD is not as accurate since the correlation between the two is stronger at ICP levels greater than 20. The correlation between ICP and ONSD is stronger at intracranial hypertension than at normal ICP levels. And ONSD correlated with the invasive measurements of ICP better than other non-invasive techniques. After ICP returned to normal, the optic nerve sheath diameter was still expanded, which is a reason why the ONSD wasn't as accurate at predicting or at measuring ICP when the ICP was lower. And then the relationship between PI and ICP still isn't completely clear, but this study stated that PI should be used more as a dynamic trend of ICP rather than giving us specific measurements of ICP. So further, ONSD might be the best option for non-invasive measurements of ICP, and that can be really useful in settings like a small rural hospital who might not have the appropriate supplies for invasive measurements of ICP. And it's also useful in a field of research that I'm interested in, and that's how ICP changes during space flight. So we currently need non-invasive ways to measure ICP while in a microgravity environment, since invasive methods aren't really realistic aboard a spacecraft. There's the citation. And does anyone have any questions?
Jennifer, I got a couple, if you don't mind.
Okay.
Pertinent to anatomical variations of putting the probe in the right spot. How do you know you're over the right vessel?
Right. I'm not exactly sure if they had specific like markers for the accuracy, but I do know that I've read in some other studies that there's like a right spot somewhere on the brain to get the angles right and get the right measurements.
When you do that, do you have different size probes for, let's say, infants, adolescents, adults, or one size fits all, or what do you have?
I'm not sure. I would assume that it would probably change depending on the age of the individual.
Yeah.
I think this study was all just adults, so I'm assuming they just used the same probe, same size probe for everyone. But since infants and children's brains are obviously smaller, probably a smaller probe, but I'm not positive.
And pertinent to the degree of trauma, particularly skull fractures. I'm not clear on the techniques of how that's implemented. I can see the value. I can see the getting the data useful, but it seems like it's really within the expertise of the sonographer of how and where to put that probe, particularly in the setting of head injuries. Can you comment on anything about that?
Yeah, one thing I'm looking at with potential methods of measuring ICP in a microgravity environment is that a lot of these methods require a skilled operator, excuse me, and that would prove difficult in these like rural hospitals or aboard a spacecraft. So there's still more like tweaks I think we need to figure out, more like a protocol of training more people to, you know, get the right spot every time.
Yeah, it would really seem like it'd be very technician dependent.
Yeah.
To the experience that the operator has. Okay, thank you very much.
Yeah, thank you.
Any other questions? If not, thank you so much, student Dr. Perrault. That was a great presentation.
Thank you.
Really interesting dynamic between neuro and like space. That's something I've never even thought about before. Like, it really is like cutting edge research because all of it's so new. It's not like, you know, something you just think of every day. So great presentation. Thank you.
I want to congratulate you too. You're on the cutting edge, and this is a first-year medical student, people who's stepping up and stepping into the limelight in this room. So, Jenny, I appreciate you a lot.
Thank you.
All right. Well, with that, there is not a journal club next week, but there is another one the week after, and they are then weekly the rest of the time after that. So I encourage everyone here to attend other ones in the future. We have some exciting ones coming up. So thank you again, student Dr. Perrault. And thank you everyone for being here today. Happy Friday. It's kind of warm out, so everyone enjoy the warm Friday weather.
Happy Friday.